We are also aware of the challenges the healthcare workers face when accessing care under the Social Health Authority. It is inconceivable that those who deliver care cannot themselves access quality care. And I repeat it, it is immoral, unacceptable that those who deliver care cannot themselves access quality care. I am working closely with the Social Health Authority, who their chairman is here, the Digital Health Agency, the institution that locks you out. By the way, it's not even SHA that locks you out. It is the system, it's the super digital highway that locks you out. The CEO is here, the Council of Governors, the Ministry of Public Service, and the National Treasury to resolve these issues immediately and decisively. We must care for our carers. We must care for our carers. And today I'm happy that one of the governors who believe in the implementation of the UHC is sitting here. And I will endorse, and I will take his proposal to the Council of Governors that the SHA contribution for not only healthcare workers, but for all civil servants, both at the national and at the county level, be deducted at source. Because it doesn't, when I came to the ministry, I couldn't understand how government wanted UHC to be successful when its own public servants and healthcare workers are the people who are locked out. So when they go to hospital, if the nurse and the doctor and other health workers say, I don't have a cover, so SHA is not working. That was why we had a problem, and nobody was seeing that. So I think the proposal of His Excellency Governor Abdul Samad, a very progressive solution, is the one that I will take to the Council of Governors, to Public Service, to the National Treasury, to the Presidency, Dr. Mai is here, and to the Cabinet, that we deduct SHA contribution at source. And the person that will do that, all after we agree, is the CS National Treasury. I must also speak very candidly on the internship crisis. Delayed posting, inadequate supervision, and what I call oversupply from our institutions are all part of the broken pipeline. So we must fix the pipeline. The truth is, we are seeing the effects of unregulated expansion in training institutions, some of which admit over 4 times their capacity. And the CEO of KMPDU is here. My next port of call is to have a discussion with these institutions. If the council has told you to admit 50, you must admit 50. You cannot commercialize the training of doctors. And we are going to inspect. We are the regulators. The council is here. We will have a discussion. We will regulate the facilities. We will find, number one, whether you have all the facilities to train a medical doctor. And 2, what is your capacity? I'm already aware of training institutions that were given by the council 50 students and they admitted 200 because of commercial interest. You have to help me. We have to protect this profession. We have to protect who is training, what is training. This threatens the quality and the integrity of our healthcare system. We must uphold training standards and protect the profession. Our regulatory bodies, especially the Kenya Medical Practitioners and Dentists Council, must be empowered to enforce quality, not just quantity. The ministry is committed to working with counties to expand internship centers and improve equitable deployment. In a few days, I will convene a multi-stakeholder forum to chart a sustainable path forward. KMPDU, the union, will be at the table. Let me also reassure you, our young doctors are not forgotten. Just last week, 1,035 medical officers interns and 83 dental officers interns successfully balloted for the internship placement, together with the 503 pharmacist interns who will begin their rotations in July of 2025. And I've already factored the budget for those interns in the 2024-2025 budget. Our goal is to align internship numbers with our national budget and healthcare service delivery needs. This is not just about numbers. It's about dignity. It's about equity. It's about ensuring our doctors are trained and absorbed in ways that uphold professional standards and meet the healthcare needs of Kenyans. You will help me streamline the internship system. The National Treasury, Parliament that has a role in budget making, must have numbers and figures that in the next 5 years, 10 years, how many doctors are we going to train as interns? We can't have 1 year 2,000, another year 3,000. That we will not do it. And we will not allow people to turn this noble, dignified profession into a place where they can make some money. And that lies with the Ministry of Health. That lies with the regulator. And I want to ask the Commission for University Education, you can squat somewhere else, but not in the Ministry of Health. No way. Even if it means amending the law, we are going to amend the law. Yeah. And Dr. Kariuki, you have my support. From next week, we will visit all the training institutions. And first we will find whether you qualify to train, whether you have the right facilities. We can't have an internship program at Kenyatta or Kenyatta National Hospital where there are 50 students in a small room undergoing internship. Internship is a very vigorous individual exercise. I'm not a doctor, but I have doctors in my family. And this is a discussion I had with the president. The president has no problem. Government have no problem in paying. But we must regulate it. We must have a plan. I really want to urge all of you leaders, delegates, and members to remain engaged. Let us keep the lines of communication open. Let us work together to strengthen the foundation of our health system. All of us together, we need, and other healthcare workers in the country, we need to bring back the hope and the confidence the people of Kenya should have on their healthcare system. The government is investing in its people. You are that investment. And with your input and partnership, we will build a system that is fair, that is responsive, and that is world-class. Together we can make UHC a reality, not just in policy, but in every clinic, in every ward, and in every operating room across our country. Speaking for SHA and Digital Health Agency, and I'm happy the governor of Mombasa is here. We have noted that some of the healthcare workers, including maybe doctors, are sharing their pre-authorization codes to facilities. And this is used for fraud. You know, I speak very straight, so I'm giving you notice. I have cases where a facility and the doctor who was given the pre-authorization code are 600 kilometers apart. The facility is in one corner, the doctor is in the other corner, the distance is 600 kilometers. And that facility is claiming that 10 surgeries have taken place. A'udhu billah. That's a very serious statement. When a Muslim says that, is that you are close to hell. And what I'm saying is serious. So I don't want to say it in public or in parliament. So when this doctor was contacted, he said, I have never been to that facility. Little did he know that the next question will be difficult to answer. The next question that was asked was, then how was your pre-authorization code shared? That is why he started wondering what's going on. Help us. Help us. You know, our country must be, particularly the health sector, we must exercise high degree of integrity. And doctors are known for that. You know, when you see organ harvesting, illegal organ harvesting, you can see how integrity has been compromised. And that's why I have said it, and the PSS are here, the CEO of the council is here. No foreign doctor. Some of the foreign doctors in our country have been deregistered by their own councils. We know them. And we can only have them if we have a shortage. Kenya is a leader in the global healthcare system and in Africa. So we have enough doctors. We have enough specialists. People come and learn. We are a leader in the healthcare in our region and in our continent. So me and the PS and Dr. Kariuki, the only exception we are giving, and I've done it for a few governors, is if those doctors are coming on a humanitarian ground, they're coming to do a camp in Kakamega, now they're a camp in Lamu, we will agree. And I hope you have, and you need to do a serious evaluation and assessment of the foreign doctors who you gave license before. We will not agree that we are producing doctors that have no jobs and we are importing doctors. We will not. That you can take it to the bank as long as I am the Minister for Health. My turnover the last 2 years is very high, so I don't know whether I will. And you know when Devji, yeah.